Hello, I'm Dr. Todd Osborne, and welcome to Strengthening Your Child's Immune System, presented to you by Scenic City Clinic of Chiropractic. Every parent wants a healthy child, and a healthy child depends on a strong and properly functioning immune system. There's been growing concern about the health of children, and recently there's been dramatic increases in immune-related disorders like asthma, allergies, autoimmune functions, and food sensitivities, just to name a few. This has prompted people, especially parents, to do a lot of reading and research regarding health and increasing the immune system function. If you go into any bookstore and go back to the health area, you'll find a large section of books regarding building the immune system and its role in health. A recent Google search for immune system boost brought up over 26 million hits on the subject. Psychoneuroimmunology is the study of the interaction between the psychological processes, the nervous system, and the immune system. The main interest is the complex relationships between the nervous system, the immune system, and the relationship between mental processes and health. Psychoneuroimmunology studies, among other things, the physiological function of the neuroimmune system and its role in health and disease. The field of immunological research is fairly new, and not much was known about the workings of the immune system prior to the invention of the electron microscope in the 1930s. And even then, it didn't get a lot of attention from the research community, mainly due to many misconceptions of how the immune system functioned. It was thought that the immune system was completely independent of the control of the central nervous system. However, that started to change in the mid-1980s when AIDS prompted researchers to begin investigating the immune system in depth and looking at it from a functional unit, not just from a disease or pathology standpoint. Then the 1990s were dubbed the decade of the brain because the research community renewed its interest in studying the brain and the nervous system. And there were many amazing discoveries, with two of the most significant being the importance of the nervous system in health maintenance and the complex interaction between the nervous system and the immune system. In their landmark book, The Healing Brain, Drs. Ornstein and Sobel said to understand health is to understand the central role of the brain and the nervous system in maintaining the resistance of the body. Health maintenance is the primary function of the brain, not educational thoughts, language, poetry, and other functions usually associated with the brain. The research community never publicly admitted that they had been incorrect about the nervous system-immune system connection, but their writings and research definitely indicated a new direction in this understanding. The Lancet wrote, "The focus of science has shifted from separate entities of the immune system to an interactive immunology model. In the neural immune concept, the brain has specific two pathways to the immune system." By the mid to the late 1990s, every medical anatomy and physiology textbook in the world confirmed that the central nervous system was in complete control of the immune system. Armed with this new data on the immune system, many magazines and research periodicals began writing about the healthcare paradigm shift that was soon to take place. Newsweek magazine had this: "Pressed by patients and advancing technology, healthcare will soon change its focus from treatment to enhancement, from repair to improvement, from diminished sickness to increased performance. The transformation has already begun. Accompanying this will be an increased emphasis on psychoimmunology, the science that deals with the mind's role in helping the immune system to fight disease, which will become a vitally important clinical field, perhaps the most important field of the 21st century. The major organs of the immune system include the bone marrow, the thymus, the spleen, the lymph nodes, which includes the lymphatic vessels and make up the lymphatic system. The job of the immune system is to protect and defend the body against infection from disease-producing microorganisms, such as viruses, bacteria, fungi, and parasites that live in our environment. Dr. Robert Ader performed key experiments that proved the brain, nervous system, immune system connection. The following summarizes the essential evidence of the physical connection between the brain, the nervous system, and the immune system. Nerve endings are found in the tissues of the immune system. The central nervous system is linked to both the bone marrow and the thymus, where immune cells are produced and developed, and to the spleen and lymph nodes, where those cells are ultimately stored. Changes in the central nervous system alter immune responses and trigger an immune response which alters the central nervous system activity. Researchers have found that inducing an immune response causes the nerve cells in the hypothalamus, which is part of the brain, to become more active, and the brain cell activity actually peaks at precisely the same time that levels of antibodies are at the highest. There is no doubt that the brain monitors immunological changes very closely. And the lymphocytes are chemically responsive to hormones and neurotransmitters. The T cells and B cells have tiny molecular receptor structures on their surfaces that allow them to receive information from the nervous system and other parts of the immune system. It's the nervous system that controls the entire growth and development of the immune system. A baby's immune system is immature at birth, and fortunately, a newborn carries passive immunity from the mother for the first several months of life. And then breastfeeding provides the infant with antibodies and immune-enhancing factors that allows the baby to develop immunity. Babies' lymphocytes are not yet capable of producing all the antibodies necessary for fighting disease, and a baby acquires this over the first year of life. Human breast milk is biologically specific for human babies. This means that each species of mammals makes specific milk that is uniquely suited for that of its young. Each drop of breast milk is alive with millions of tiny white blood cells and immunoglobulins that are infection-fighting proteins that circulate throughout the baby's body. They ingest and destroy the harmful bacteria or other microorganisms, kind of like a miniature Pac-Man. As the baby begins to lift its head, it's developing the very important spinal curves that give support and protection to the nervous system. Kids begin to crawl around 6 months, about the same time their own immune system starts rapidly developing. The cross-crawl motion causes increased nerve firing into the major organs of the immune system, and thus causes rapid development of the child's immune system. And as the child is exposed to microorganisms, the lymphocytes start to make antibodies and immune system memory cells. So when the baby comes in contact with those microorganisms the next time, their immune system is prepared and will mount an immune response much quicker. As they begin to crawl, we all know they begin to put everything into their mouth. And while this can be disconcerting sometimes to parents, this is actually a natural way for them to expose their immune system to the tiny antigens which the immune system must attack and destroy. And this process actually exercises or strengthens the immune system and will protect the child. One of the most important things that we've learned from recent immune system research is that the immune system develops in combat. In other words, it has to work out. It has to strengthen itself. Childhood colds, fevers, infections are the methods that the immune system uses to strengthen itself and help the child become more immune. Healing Arts Press indicates that through the process of developing and then conquering infection, the child gets rid of acquired toxins and poisons from the body and also gets a generous boost to the immune system. Dr. Weil says, whenever the immune system deals successfully with an infection, it emerges from the experience stronger and better able to confront similar threats in the future. Our immune system develops in combat. If, at the first sign of infection, you always jump in with antibiotics, you do not give the immune system a chance to grow stronger. Dr. Stephen Cummings said this, symptoms represent the body's best efforts to heal itself. By treating symptoms, you are actually suppressing the body's natural response and inhibiting the healing process. Instead of treating the symptoms, doctors should stimulate the body's defenses to allow for completion of the healing process. Therefore, a properly functioning nervous system should be the first priority of strengthening the immune system, since the nervous system is the master system that controls all of our bodily functions, including our immune response. The nervous system works by sending and receiving nerve messages or nerve impulses to all parts of the body. This system is protected by the spine, where we have 24 movable vertebrae. When the spine is in its proper position, it protects the nerve pathways. But when it's misaligned, interference can occur to the nerve impulse, which reduces the overall function of the nerve system and to the organs to which it is assigned. These spinal misalignments are known as vertebral subluxations. As indicated in Science magazine, nerve dysfunction is stressful to the visceral nerves and other body tissues, and the lowered tissue resistance modifies the immune response and lessens the overall capability of the immune system. The birth process, even under routine conditions, can often be the first cause of stress or subluxation. After the head of the baby emerges from the birth canal, the doctor grabs and twists it in a figure-8 motion, lifting and pulling up so that the lower shoulder can be birthed, and then twisting it the other direction and pulling down so the other shoulder can be birthed. This creates significant stress on the delicate upper neck area of the newborn baby. Dr. Tobin says spinal cord injury and brainstem injuries occur often during the process of birth, but frequently escape diagnosis. In infants who survive, there may be lasting neurological defects reflecting the primary injury. Spinal injury at birth is attributed to the longitudinal traction or pulling, especially when this force is combined with flexion and torsion of the spinal axis during delivery. So that longitudinal pull, along with flexing and twisting the baby's neck, can certainly deliver problems. The national cesarean rate is increasing steadily. Now 1 in 3 mothers give birth by C-section. And it might seem that birth by C-section would be the easiest and least traumatic way to be born, since the infant doesn't have to hazard the rigors of a long labor or a constricting birth canal. Unfortunately, we have found that trauma to the newborn delivered C-section is different, but no less traumatic than the trauma that occurs in a vaginal delivery. Along with the birth process, during the first 2 years of life, infants will often fall learning to walk. They may tumble off of beds or furniture, and even seemingly playful acts such as tossing the baby up in the air and catching them can often result in a whiplash type trauma to their neck. Even auto accidents can injure the baby. Most of the time the entire family is involved, and many times the baby can go unchecked because they have no obvious symptoms or damage. But because of the delicate structure of the infant's spine, spinal stretching from the trauma is more likely to occur from the spinal cord trauma with nerve interference than it is due to actual damage of vertebral segments and soft tissue. One of the top neurologists in the world stated that interference to the nervous system results in damage within a short period of time, and therefore chiropractic care should begin at birth on a preventative basis. The purpose of upper cervical chiropractic is a healthcare system that's founded on the premise that a properly functioning nervous system is essential to overall health and function of the human body. Doctors of chiropractic can detect and correct vertebral subluxations by adjusting the spine. This then restores the nervous system to an optimum level of function, which maximizes the body's healing potential. Chiropractic adjustments restore normal nerve function. It restores normal brainstem function, improves spinal biomechanics, range of motion, reflex arcs, and improves posture, all of which are essential to a properly functioning nervous system. Studies have measured the effect of chiropractic adjustments on the immune system and have shown that chiropractic influences T and B lymphocytes, natural killer cell numbers, antibody levels, phagocytic activity, and plasma beta endorphin levels. In another study published in the Chiropractic Research Journal, it compared the health and wellness of 200 children under chiropractic care to 200 children under conventional medical care. The chiropractic group had fewer ear infections, fewer allergies, fewer cases of tonsillitis and asthma. The health of the children under chiropractic care was demonstrably superior to the children who had not received it. Nerve interference associated with birth trauma may result in problems such as breathing weaknesses, mood irritability, digestive disorders, difficulty with feeding and attachment, sleeping problems, immune deficits, and neurological impairments. Upper cervical chiropractic adjustments for newborns utilize very precise, light, and gentle pressure to make a slight movement and correction of the top bone of the neck called the atlas. And many times the baby is actually soothed and enjoys the adjustment. It's important to point out that 65% of the neurological development, in other words, the brain, the spinal cord, and the nervous system, occurs within the first 12 months of life. So it's really imperative to ensure babies have every opportunity to maximize their nervous system function during this critical period of development. Dr. Lyndon Smith, pediatrician, says that every newborn should receive a neck and spine examination and a chiropractic adjustment if necessary. Is that idea too difficult to accept? And finally, Dr. Lee Hadley says subluxation alone is a rational reason for chiropractic care throughout a lifetime from birth. We hope you have enjoyed the presentation on strengthening your child's immune system. If we can help you in any way, please call Scenic City Clinic of Chiropractic. I'm Dr. Todd Osborne, and thank you for joining us for our presentation.